Smooth health on the drive.
It's a global observation that helps raise people's awareness.
Insightful tips and information to live in a healthier and happier life.
How to prevent it, detect or treat it.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
If you didn't know, now you know.
This is Smooth Health on the Drive.
Welcome if you just joined us. This is Smooth 98.1. Love music, love life. It's 5:16 by the time it's time for Smooth Health. On our show today, we're talking about the gastric Botox and other endoscopic weight loss procedures. And we've got a very special guest with us in the studio today.
Right. Our special guest is Dr. Nikoloz Dzagidze. He is a consultant laparoscopic surgeon with a specialty as an endoscopic doctor and a senior scientific researcher. He was the first surgeon to perform endoscopic contact laser colon polyps. Right, and this happened in 2004. He had admitted fellowships in laparoscopic surgery in Innsbruck University Hospital, Austria, as well as Izmir University Hospital in Turkey. Now, in 2020, Dr. Nicolas joined Evercare Hospital, Lekki, and currently holds the position of consultant laparoscopic surgeon with key interest in provision of quality surgical care in surgical gastroenterology. This is it's a lot. I know. With surgical care in surgical gastroenterology and endoscopy as well. Bariatric and metabolic laparoscopic surgery. Ooh.
Wow, that's a lot. Welcome, Doctor. Welcome to the show.
Thank you for inviting me to the radio station. I'm happy to be with you here. Good evening, our dear listeners. Good evening, citizens of Lagos and all Nigeria. It's a great pleasure to me to be here with you. Let me express my admiration with your nation and country. I had no chance before to show up in the front of a big audience like today. So you make me feel so delighted with your hospitality and warm relations. First of all, these are my colleagues from Evercare Hospital Lekki, which becomes my home for past 1.5 years. I greet all of you.
All right. Thank you so much once again. Now, if you're out there and you want to be a part of our conversation, please call the number 0144899981. I'll say that again. 0144899981. If you're wondering what we're discussing, we're talking about gastric Botox and other endoscopic weight loss procedures.
All right, so Dr. Nicolas would like to basically kickstart with the basics. So what exactly is gastric Botox?
Thank you for your questions. To understand what we are talking about, first of all, I should explain some about obesity. Obesity had become a real issue in a modern reality, so World Health Organization included it into the list of diseases. Usually obesity is caused by the fact that we consume more food or calories, if you want, than we can digest, and it deposits as an excessive fat tissue in our body, starting from the belly, then spreads to the thighs and torso, other body parts, causing cosmetical and later health issues. Modern medicine has developed various methods of obesity treatment, starting from special balanced diet and exercises up to complex surgical procedures as a gastric bypass and sleeve gastrectomy and even more. This method, called gastric Botox endoscopic injection, has been developed in recent years. It is less invasive, fast and harmless procedure designed for weight loss in obese people.
All right.
Right. So when you think of Botox, you think about injections in the face,
Exactly.
To keep those muscles nice and tight. But how does this work?
Botox is used in medicine for a long time. It acts as a paralyzing agent for muscles. It's a toxin, in fact, produced by botulinum bacteria. And initially it was used for cosmetical procedures facial skin wrinkles. Some ladies should know about that. Nowadays, Botox is used to treat various digestive diseases, including esophageal, stomach, and anal narrowings. The acting mechanism of the Botox is based on the paralyzing of the muscles. Because the human stomach is a sac with the muscles, which acts autonomously. After receiving food, it delays in the stomach for 2 or more hours, digests partially, and then gets evacuated down to the intestines for further digestion, finally to form a stool. So when injected into the stomach wall, Botox paralyzes it partially, of course, and leads to slowing down food evacuation and lesser hunger hormone production. As a result, we eat less and get slimmer.
Nice. Nice. Well, it doesn't work for me, though.
Would he be eligible for gastric Botox?
No, so he looks so fine. I don't think.
If I had a gastric Botox, I probably would disappear. So
Probably.
it won't act on you. It won't. You will keep your appetite there because it acts as higher is weight, and I will talk later. Body mass index. The better is effect. For the people who had normal body mass index, it won't work. So in general, people with obesity are fit for this procedure, but better effects are achieved in a group of patients with a first and second class of morbid obesity. For better understanding, I will talk about body mass index. It's our weight in kilograms divided by height in meters squared. This is boring science, but this is how we count a body mass index. Almost everyone has mobile devices in hand, so you can download body mass index calculator from Google Play or Apple stores and count your own BMI, understanding do you fit for this procedure or not. Also, stomach itself should be in a good shape.
Okay.
Sick stomach doesn't fit this procedure, and not only this, no procedure for weight loss. There should not be acute inflammation, ulcers, or even worse issues, which should be treated by a physician. Our usual customers, they are very diverse. Young ladies who want to control their weight, or elderly people in need of weight decrease because of knee joint problems or lumbar pain.
Okay.
So as it can be also a part of pre-operative preparation to lose some weight before serious operations. Important point is motivation. If one wants to continue eating as usually and do not change habits, they do not fit for this procedure and need gastric bypass surgery.
All right. Thank you so much, Doctor. By the way, if you just joined us, this is Smooth Health on Smooth 98.1. We're talking about gastric Botox and other endoscopic weight loss procedures. And if you're out there and you think that you might need this service, you know what? Call us and let's have that conversation. 0144899981. The doctor's about to work us through the procedure of gastric Botox. So, Doctor, I want to ask you this. How long does the procedure take? And also, outside the fact that how long does it take, what's the healing/recovery process like?
Okay, I realize that it will sound a bit sensational. So what you say, if I'd offer you to lose extra pounds through 25 minutes outpatient procedure without any wound, scars and rehab period, painless and cheap in comparison to, and you go home in 1 hour after that, sounds like fairy tale.
I would
jump
take
on
it.
But it exists, and it's in Evercare Hospital right now.
Wow.
Yeah.
Okay, so there's no need for any sort of aftercare service or anything like that?
Dietitian and follow-ups.
Okay.
Procedure is done in an endoscopy unit, which offers customers isolated from other units comfortable and quiet environment. For easy understanding of the procedure, for our listeners, I should say that this is diagnostic gastroscopy, as it is, performed by video endoscope through the mouth, finalizing with Botox injection. It takes 20-30 minutes, no more. Anesthesia team, including consultant doctor and the nurse, provides sedation. It's not general anesthesia. It's just some IV injection to sleep means that patient is in sleep and doesn't feel any discomfort during procedure. Endoscopy team itself, with 2 consultant doctors, nurse and assistant, control safety of the whole process. After wakening up, patients are kept under observation for approximately 1 hour, maybe less, maybe more, but it's around 1 hour, and leave facility after receiving instructions and medication for their further management. Follow-ups are recommended to manage special diet and weight loss.
All right, doctor, I want to ask this. When people undergo a procedure like this, the gastric Botox, how long would it take for the results to become obvious, to say, okay, the scales are dropping?
Okay, that's the most important questions. How long and how much? So effect can be immediate. Sometimes it takes up to 10 days. Early feelings are satiety or full tummy, inability to eat as much food as before, and weight loss. So the most aggressive weight loss happens on the first month after procedure, first 30 days, 50% of initial weight loss. After that, weight loss is slowing down and finishes in 6 months when Botox effect wears out. And it is very natural type of weight loss, no hanging skin folds and wrinkles, no rebound effect from fasting diets. Patients should develop healthy dietary habits by the time and should be able to conserve results if no other background disease. For example, knee arthritis.
Right.
You cannot walk, so you cannot keep your weight loss. So this type of patient, they come back for procedure sometimes.
All right, so after
or
about
just
6
develop
months.
dietary habits.
Okay. All right, so moving on to the next question. How much can a person actually lose from the procedure, possibly in kilograms?
This is the most important question of our evening, I guess, because we can talk a lot, but people want to know how much. 20% of initial weight loss happens. It's average. It's a scientific statistics. Average weight loss is 20% of initial weight. As an example, 100 kg person can become 80 kg in 6 months, but 90 kg after first month. The last 10 kgs they are living body in
So
during
it's spread
5 months. Yes.
Right. So it's faster immediately after the procedure.
Yes.
Oh, okay.
All right.
So if you compare risks and benefits, that's really good. Otherwise, for bariatric surgery, 20%, it's not so much, but it's not a surgery, it's a procedure, and I told you how it happens.
Yes.
All right. Let's shift our focus a little from gastric Botox, and let's ask this question. What are some other endoscopic weight loss procedures that are available?
Comparable by weight loss effect is gastric balloon insertion. That is also endoscopically guided procedure, as we talked earlier. And a special designed medical rubber balloon is inserted into the stomach orifice from oral approach and inflated with an air occupying from 500 to 600 milliliters of stomach space. So effect is almost the same. Full tummy feeling, lesser appetite, weight loss. Pros of the method, it's also less invasive, no scars and incisions, might need just 1 day of admission. Cons, balloon wear out in 6 months and need endoscopic removal again. So if it's not done on time, balloon can rupture and cause acute intestinal obstruction, emergency situation resulting into open abdominal surgery. It's rare but possible.
Okay.
So this is main endoscopical procedure that we can offer except gastric Botox.
So is the balloon the same as the band?
It's absolutely different.
Okay.
Band is a surgery.
Okay.
It's wrapped over the stomach inside the abdominal cavity. By the way, I removed one 3 days ago after slippage. Well, I'm not promoting anti-surgery. No way, I'm a bariatric surgeon. But it can the bigger surgeries, the more are complications. So the band can slip down from the stomach. I mean, down means from upper part to lower part, obstructed, and person cannot eat and drink. And we had case recently, so we removed it laparoscopically again.
Right. So, of course, this is why the procedures are preferred.
This is different type, yes.
Yeah. All right. We'll take a quick break, and when we return, we'll continue the conversation with Dr. Nicolas. If you've got any questions or comments, please send them to us via WhatsApp 0809 444 0981.
This is Smooth Health on the Drive.
It's a global observation that helps raise people's
Smooth
awareness.
Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
There's nowhere on this earth that compares. Smooth.
Hey guys, my name is Rachel Kerr, and let me tell you about My Lagos. There's nowhere on this earth that compares. From mainland to island to the roadside soya, there's nothing like that. And of course, the sweltering heat from morning till evening. Now in My Lagos, nothing compares to the weddings. Nothing compares to our parties. But one thing I will say is there's nothing like reaching your land of Lagos. My Lagos, your Lagos.
Smooth 98.1 still is what you're listening to. It's 5:32 by our time, and of course this is Smooth Health. Today we're discussing gastric Botox and other endoscopic weight loss procedures, and we have Dr. Nicolas with us in the studio. Now, to be a part of our conversation, you can call us. Call the number 014489981, or better yet, just send us a WhatsApp message. Your messages come to 0809 444 0981.
Now, before we went on the break, you spoke a little bit about some of the other endoscopic weight loss procedures. Could you just go over them again?
What we are doing in our hospital, these are non-invasive or less invasive endoscopic gastric Botox injection and gastric balloon insertion procedures. And also we are planning to launch in nearest weeks, and we're working hard on it, sleeve gastrectomy surgery, which is a different type for heavier patients, for more obese patients with comorbidities.
Okay.
So this is a list from Evercare, what we are doing at the moment.
All right. So among the procedures that you listed, the non-invasive procedures, which would you advise is the best or maybe even the safest procedure for people who are looking to lose some weight?
Well, this depends on patient's body mass index, also comorbidities like diabetes type 2, patient's motivation, and sorry to say that, financial possibilities. There is no universal formula for everyone in weight loss procedures. We select and treat patients individually, betting first of all on the patient's safety in Evercare Hospital. I think a good example is the fact that hospital won Safe Care Certificate Step 5, this is the maximal step award, on the first accreditation exercise recently. I can say that we have some universal and safe method for everyone. It's very, very individual. But gastric Botox is the most easy and fast method to get the result.
All right. Thank you so much, Doctor. Well, I mean, this sounds really interesting, but I'm sure that our listeners are wondering, are these weight loss procedures, including the gastric Botox, available at Evercare Hospital?
Yes, sure. We are doing, currently we are doing gastric Botox procedures actively. We can do in gastric balloon insertion, and the nearest plans, as I mentioned.
Just before you finish that, I think we have a caller. Hello, good evening.
Hello.
Hi, good evening.
Good evening.
Yeah, good evening. How are you guys doing?
Very well, thank you.
I ran into this program at the right time. I have a very peculiar case on hand.
What's your name and what's your location first?
My name is Austin. I'm calling from somewhere around Maryland now.
All right, go on, Austin.
Yes, I have a relative, my sister, who is just about 5 feet plus, but her weight has ballooned over 190 kg. What is possible in her case to reduce this weight? We need it like yesterday. She's become so obese that she's become almost moribund. Morbid, completely morbid. And so I went home and saw this pitiable situation. I never knew it's gone so bad. I have looked everywhere looking for a solution. And that's why I said I ran into this program at the very right time.
All right, thanks, Austin.
Good evening, sir. I'm Dr. Nicolas. I am the surgeon in Evercare Hospital. If you are aware of height and exact weight of your sister, I will count immediately for your body mass index.
Yes, let me just round it up and say 5'4".
Okay.
And the weight of because the doctor, they were not too sure. He said the weight, their scale couldn't take her weight effectively, but it's estimated about 195.
195 kgs.
Yes, kg.
Okay,
yes,
that's
kg.
very 195. That's too much. Well, I think 195 is probably too much because it's showing me not abnormal parameter. It's 73. It can't be so high. Probably it's lesser than that, but that means that person that you are talking about has a morbid obesity.
Yes.
And what she needs probably is a surgery for permanent weight loss. For further communication, you can connect to our hospital's number, which is 0813 98 50 710.
Can I put that back? 081
081
39
985 07 110.
All right, thanks, Austin. Thanks for calling.
Okay. I appreciate it.
Thank you, sir.
All
You're
right.
welcome, Austin. If you need any more information, you can visit the website www.evercare.ng. You have the phone number or send an email to info@evercare.ng.
All right, so doctor, we were talking about these procedures that are available at Evercare, and you were giving us the details.
Sure. By the way, I will just speak about the latest call for the persons or let's say patients with severe obesity. Gastric Botox is an option just for a temporary relief. And for them, for permanent weight loss is designed surgical procedures, which are part of modern medicine. So we do that. We are going further, and for this kind of patients, we have specialized unit in the hospital where furniture, environment, instruments, and everything is fitable for the patients with high rate obesity. Like imagine 200, 250 kgs persons. They need special bed, they need special bathroom, they need special chair and everything. We have it all in our facility, so we can offer them comfortable treatment during their after their surgeries.
All right. So I just want to come back to we asked this question earlier, but just for everyone who's joining in, just to clarify, who's eligible or suitable for gastric Botox?
Almost everyone who has high weight, because depends what the person wants. If you are motivated and you want to lose weight from fast and cheap procedure, which acts up to 6 months, gastric Botox is for you. If the person is sick, have comorbidities, cannot move much, or is almost disabled, then surgeries are recommended for this kind of patients. Gastric Botox, let's say, it's almost universal for obese patients. Better results are achieved in the first and second class of morbid obesity. Third class is mostly for operations.
All right.
Okay.
Thank you so much, Doctor.
I wanted to ask, and for women who are perhaps pregnant or breastfeeding, can they undergo this procedure?
There are no scientific data for that kind of patients, so we don't do that.
Okay.
We don't do that for pregnant women because of absence of the scientific data.
Okay.
All right. Thank you so much, Doctor. Just before we let you leave, we'd like you to, share with us some parting words or advice for our listeners out there.
Sure, with pleasure. As a doctor, I have 20 plus experience of being a surgeon. I'm always concerned about health of population whenever I work or live, because I worked and live in many countries before. So the easiest, the cheapest and most safe way to stay healthy with normal weight is diet and lifestyle. Mm-hmm. So many of us abandon basic principles of taking care of our body, which needs special treatment, really. It's a God's gift. So if it's not working, lifestyle, you still keep doing diet, gymming, but you still gain weight, do not hesitate and attend professional doctor. Almost all diseases are treatable at early stages. So we do all kinds of abdominal and miscellaneous surgeries in Evercare Hospital. So you can attend professional in our hospital too and get the qualified care.
All right. Got a few messages just before we let you leave. This one here says, please, what are the long-term side effects of the Botox? And Temitope comes in and she says, I have a BMI of about 30. I am a dress size 14. Can I have the gastric Botox?
First question. It sounds strange for medical procedure, but there are no long-term side effects.
Okay.
There are short-term side effects, as first 3 to 7 days nausea, maybe vomiting, some abdominal cramps, and no appetite, which is the idea of the procedure. So no long-term side effects from Botox procedure. And the lady said she has
BMI of about 30.
30. Ideal candidate. If she has no other issues with the health, she is ideal candidate for that. And almost guaranteed, relying on my own experience, because in my country this is very popular. We have queues of young ladies with not I can't say obese, just first class obesity, is almost overweight. So they are ideal candidates. They keep weight and they stay happy after first procedure, maybe 2, and then they keep their weight for a long time.
All right. Well, thank you so much, Dr. Nicolas, for joining us today on Smooth Health and giving all this very insightful information. Could you tell us how the listeners can contact Evercare?
You can contact through our website and book your visit from there. Also, you can telephone us. Number is 0813-985-0710. Also, you can email us info@evercare.ng and ask any questions regarding prices, procedures, specialists. You will be answered immediately in the same day.
All right.
All right.
Thank you so much, Doctor.
Thank you so much for inviting me and having me here. It was a pleasure. Thank you so much.
Stay with us. There's more to come. This is, of course, this has been the Smooth Health. There's more to come right here on Smooth 98.1. Stay with us.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Every Thursday at 5:15 p.m.
If you didn't know, now you know.
Powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.